There we are. Hi, Barbara. How
Hello,
are you?
hi, I'm
Good,
fine,
good to
thank
see you.
you. Apologies for the slight delay.
Don't worry. It's the joy of technology. It's a lunchtime. We have to get a cup of tea. We've got loads of people joining us. And I think this is a really important topic because the menopause is everywhere. It's in the media at the minute. But a lot of women struggle with menopausal symptoms during a cancer diagnosis. And it's not a gradual decline. Decline is the wrong word. It's not a gradual menopause that lasts for a couple of years. It can happen when you're 30 and it can go on for 10, 20 years. And it's hard to make people understand that it's not just the menopause, it's a bit different to what you can do. And I've had some really interesting questions. One of the first things I'd like to start with, that a lot of people have asked about, is the brain fog. So I had this with chemo, where you can't think, and then you have your tamoxifen, then the menopause hits. I could go and see 10 patients in the clinic, and at the end of the day, write all the notes. And when I went back, I couldn't remember one patient. I had to write everything down. My brain did not work as well, but the clinics still run at the same time.
Yeah.
And if you need more time to think, more time to process, more time between meetings to flip, is that something you can ask for?
Yeah.
Are there any things you can do to help?
Yeah, I mean, one of the things, let me just take one step sideways for a moment.
Yeah. We should say who you are, first of all, for people who don't know. Who is Barbara? Barbara, tell us a bit about yourself, Barbara, for those who don't know you.
Thank you, Liz. So I'm the founder and director of a social enterprise called Working with Cancer, and we support anyone affected by cancer at any stage of their diagnosis and treatment, to manage work, return to work, find work, anything that's work related. I mean, we talk about life and other things, but the focus is on supporting people to manage work and to keep working if they wish to. Clearly, it's not about making anyone do anything they don't want to do. One of the issues about cancer is that, as we've discussed previously, it's covered by the Equality Act, and you have certain rights, and employers are required to support you as far as is reasonable and possible to do, and they're required to make adjustments to support you. Now, interestingly, the menopause per se is not covered by the Equality Act. So that's a piece of legislation that doesn't apply if you're a woman going through the perimenopause or menopause, whatever, you're not covered. But at least you're not covered as yet. I think the government at one stage, when we do have a government, don't we? I've forgotten. Yeah, we have a sort of group of people. Anyway, they were thinking of adding menopause to the list of what are called protected characteristics that are covered by the Equality Act. They haven't done that yet. The interesting point is, and I have talked to some lawyers about this, is that if your menopause is arising or exacerbated or generally much more apparent to you as a result of your cancer, then it is covered, and you have every right to ask for adjustments.
So if you've had your ovaries removed, your ovaries switched off, you've been a chemotherapy-induced menopause induced by tamoxifen, aromatase, that is covered under the Disability Act, and your employers have to make reasonable adjustments.
Yeah, absolutely. And
wow.
I remember, absolutely.
Wow.
I mean, and I think, I wonder how many women don't realise that. I wonder how many employers have no idea, because clearly it's interesting, isn't it? Suddenly the menopause is, everyone's talking about menopause. It was a year ago, it was resilience. A year before that, it was mindfulness. But as we talk about menopause, it tends to still be about older women, in their sort of mid 40s to mid 50s having this, whereas actually it's many people who've had cancer treatment as well, those requiring hormone therapy, and in some cases men. Men who've had treatment for prostate cancer and are on hormone therapy will experience menopausal symptoms, and you can ask for adjustments. So what are the adjustments you could ask for? Well, really simple. I remember, all the hot flushes, and actually, by the way, I still have them. I'm one of those group of women who genetically, for some reason, I have hot flushes.
And
I
you've
will
had
have one
cancer
for the rest of my
yourself,
life.
haven't you, Barbara? You've had
Yeah.
cancer yourself, so yeah.
Yeah, I had cancer in 2005, 2006. One of the first things I did when I got back to my desk eventually was to ask for a fan, which was a simple thing. Why do you need a fan? Well, actually, because it's really helpful when I'm sitting here sweating. But other things, you know, clearly the classic thing is writing things down, because it's another way of reminding you about a task. And one of the interesting things that I came across is in some organizations, when people return to work after a period away, they have to do some mandatory training. Probably the case in the NHS as well, I'm sure, you know, refresh. You need longer to pick that information up. Often these things are timed as well. You know, you have to answer a certain number of questions in a certain period of time. It's perfectly legitimate and reasonable to request longer to do that, because it takes longer for your thinking skills to kind of catch up with what's happening. So I think it's, you know, there are other things, clearly, you know, putting notes on your computer, putting alarms on your phone, asking someone to remind you.
So part of it's kind of learning a new way to work. And a bit like when I was going through medical school, how I revised when I was 18 was very different to how I revised when I was 35, because I had a job and night shifts. And actually training yourself, you have to write things down. You're not going to remember names and phone calls.
No.
And actually being able to tell your employer, I cannot think as well as I did because I've had the menopause because of cancer and I'm not making it up and I do need this time and legally you have to help me.
Yeah,
in
absolutely.
a nice way.
Yeah, and I think and it's important what you're saying, because one of the issues that, you know, still happens and been happened for years before this is women weren't prepared to talk about what they were going through for a whole variety of reasons. You know, and particularly, you know, I used to work in a pretty much all male environment. And it's embarrassing. You kind of feel diminished, you know, as an older woman.
Yeah.
You have to say these things. And there are, unfortunately, some people out there who think it's a big joke, you know.
Yeah.
And, you know, has been the butt of jokes for centuries, you know, the hot flushes and the foggy-headedness. But it's a real issue. And I think if you can talk about this assertively, in other words, with confidence and objectively, without emotion, but just talk about what support you need, that will get you the support you need, and you won't feel bad about doing it. This
because
is not
it's the
something
fear
to
of
be embarrassed about.
No, and it's, I guess I would worry compared to my male surgical colleagues. Do I get dumbed down? Do I not given the same cases? Am I not seen as promotion because I can't think and I can't do 10 things at once? And I guess it's objectively saying it's a consequence of my cancer treatment. The menopause has meant that I cannot think as quickly. I'm still competent and capable. I just need more time.
Exactly. And, you know, in time, for many women, the symptoms either become more manageable or they diminish to the point where they're far less apparent. You know, we're all, the issue is we're all individuals. So we all have our own personal experience. But in many cases, these things aren't forever. You know, it's a consequence of treatment. It's part of the deep joy of all the wonderful meds that we're given. And if we can manage these things with confidence and understanding that essentially we're still the same talented person we always were. We're just having a few hot moments.
We are. And I guess if you can tell your employer, I am retraining, I am changing the way I work so I can be more productive by writing things down and keeping lists. So I'm doing my bit, but I need you to do a little bit as well. So it's the two of you doing it together rather than complaining, oh my God, life is bad. So this is a question. Clever responses to, God, you're red and sweating. Are you all right? Because how many times have I gone, scarf off, scarf on? You know, what do you say when your male colleague or someone says, you know, you're all right, love? I know what I'd like to say, and it's before the watershed.
Yeah, I mean, I tend actually, in some cases, I used to just ignore it. It was like, or I would say, oh, for goodness sake, you know. I can't think actually of any particularly clever responses, to be honest, Liz. I think, you know, I think the important thing is to kind of, I'm not a great one for being aggressive back to colleagues, if you know, but you know, you could say, look, if you want to make a joke of it, you can, but really it's no joke, you know. I honestly don't have a clever response. Maybe we should start a poll and ask for some that we can spread about. So
I know. What have you said? I think just being honest, it's the menopause. Get used to it.
yeah,
I've been doing this a while. It is hard, isn't it?
yeah.
How do you explain to your employer that this isn't just a quick thing? My menopausal symptoms could go on for 10 years because of my cancer treatment. I'm not going to get over this quickly.
Yeah. How do you explain it? I think you just explain it. I think you need to, you know, increasingly organisations are putting in place menopause policies. Hopefully they will have some impact and that managers will read them. But this is all about taking the time, if you're having these symptoms, to sit down with your manager and say, look, I need to have a chat with you about what's happening as a result of my cancer treatment. And talk about the side effects that you're having, which may be many and various, including the menopause. And on that basis, you would then ask or discuss reasonable adjustments. But I think unless you have that conversation, people won't really understand what you're going through.
Yeah.
Nobody's a telepath here. I mean,
no.
Yes, you may go red in the face and look sweaty from time to time, but actually, if you don't say what's going on, people may have all manner of, they may actually not even notice, to be frank. That's one of the classic issues, is that you feel that you're hot and sweaty and looking awful.
Yeah.
Frankly, most men in the middle of a meeting probably won't notice. They're too busy paddling their own canoe. So I think the thing though is that if you know you're going to have a difficult few months, years because of the treatment, sit down with your manager and talk about it. There's nothing to be ashamed of. You know, it's a process that's been caused by the treatment. Or if you have just an ordinary menopause, it's normal. You know, it's a normal part of what happens to women when they have a change of life. So, but if you don't talk about these things, it's the same with cancer generally, then people won't hear what you're trying to say and won't hear what support you need.
Yeah. Can your employers demand to see a letter from your doctor to prove that what you're saying is true?
They might demand, and in my view, actually, I know, because very often people say, oh, you know, they want to talk to my doctor. Assuming you have a doctor, sorry, Liz, these days. I would always say yes. I mean, there's nothing to hide, you know. You know, I have had some people we work with who have cancer, and their boss doesn't believe they've got cancer because they haven't had chemotherapy. I mean, God, you know, the sort of amount of ignorance out there is extraordinary. And they'll say, well, you know, I need to see a letter approving it. Well, say, yeah, fine. Here's the address. You know, you write to them. I think there's nothing wrong in giving people information if they ask for it.
And it might make your case stronger. And the fact that you're willing to give them the name of a doctor might make them think, oh God, actually, I'm digging a hole here.
Yeah. Well, and absolutely. I mean, these days, I mean, nobody wants to say their employer to court, but if you've actually shown, you know, your doctor has said this person has cancer and needs these adjustments, if your employer ignores that, then they're digging a bigger hole for themselves. So yeah.
So being open and honest and just, I guess, taking the emotion out of it, isn't it? This is what I need.
Yeah.
Any tips for her? So someone wrote in saying the fatigue is really hard with the menopause and all the side effects of cancer treatment and struggling to stay awake, especially in the afternoon. You know that your working pattern can change. Any tips on that? Can you ask to go to kind of part-time or change your hours? Is that an adjustment that someone might make?
Yeah, you can, and you can either ask for those, you know, on a temporary basis or on a permanent basis. But I think it's always best to start on a temporary basis, because I mean, very often people kind of catastrophize a bit and think, oh, I'm never gonna get over this. And actually, you know, typically this isn't forever, and it would be a real pity to kind of burn your boats and make permanent changes when they're not necessary. So I think, you can take breaks. I mean, you know, you can ask, you know, if your symptoms are, you know, menopausal symptoms arise from your cancer, you can certainly ask, you know, any reasonable adjustment that you would normally ask for if you have cancer. So to work from home, to do shorter hours, to take breaks, to you might want to change where you're physically seated, so you sit near a window, or you sit away from a radiator, or
Yeah.
whether you might sit nearer to the loo because you know you're going every few minutes. So
Yeah.
all of those things are things that you can reasonably request.
And if your employer says no, what do you do?
Well, if your employer says no, I think you have to actually go back and very nicely say, look, as I understand it, I am entitled for you to consider these things really seriously because I've had cancer and the cancer is causing these symptoms, and it's covered by a piece of legislation called the Equality Act. And I'm really sorry, but if you don't do this, then I'm going to have to take this further. So again, I don't know if you've come across it's an old kind of what am I thinking about? It's something called transactional analysis.
Mm-hmm.
And the concept of transaction analysis is dealing with people not as a parent or as a child, but as an adult.
Right.
So the child will say, "Is it okay?" And then you'll look at the floor. Is it? You ask permission. Yeah. The adult will state their case objectively, free of emotion, and say, "This is as I understand it," and you state your case with confidence. So you treat the person you're requesting this support from in an adult way, and that requires them to treat you as an adult. That's the way to get the support.
And I would say to that, this is going to sound awful, but to stop being typically female. Because I'm very, would you mind, could you, I'm very sorry in an email, and really sorry to bother you, and could you do this in Love and Kisses? Could you feel embarrassed? It's like, no, I have cancer. I know I'm covered legally. I would like you to reconsider because I know what my rights are.
Yeah,
almost
absolutely.
Be more manly. And that's the wrong thing to say in this world of, gender neutrality, but it's kind of, be confident you are legally protected. And they may not know that. Your employer may be pushing it and actually think, oh, you say legally, because it worked for me when they wanted to give me a month off to recover, having had a year off with chemo treatment. And I said, oh, but I'm protected. They went, oh, holy shit. Okay, backpedal, backpedal, backpedal. So
I'm afraid to say, Liz, that occupational health professionals, and I hope there are some listening in the National Health Service, still require people to be back at work full time within 4 to 6 weeks.
Yeah.
And that is ridiculous. And that
illegal.
Policy needs to change.
Yeah, it does. And I know it's service provision. So here's another question. Someone had worked part-time for 8 years, had to work in the office, and then COVID happened. And now they were working a hybrid of home and office, but now their employer wants everyone back in the office. And they're only allowed to work from home if they have a mandated reason. And she's scared that they're going to say no because she's had cancer. What is a mandated reason? Can we demand it?
I have no idea what a mandated reason is.
Is it just that their legalese bullshit to kind of scare people? But surely cancer is a reasonable excuse.
I think it's a perfectly reasonable excuse. And most, even half decent employers would see that as a reasonable excuse. It'd be interesting to look at the policy. There must be a policy somewhere on their intranet saying what a mandated. There might be a list of reasons, but there's a perfectly good reason. And what I would say is if you're worried about not being in the office might be detrimental to your career and you're worried about it, there's always a halfway house. It might be that actually that particular individual might only need to kind of work at home for 1 day a week or something. Yeah. That's enough to kind of cope with the fatigue. So it isn't, life is never about all or nothing. There are ways to do these things. And
that, I guess, that may be where writing to your oncologist secretary to say, my employer's being a pain in the bum. Can you say that I need to work from home because of my fatigue? And most doctors will do that for you, but it's really, really hard, isn't it, that we're having to make these awful decisions?
Yeah.
Now, another question I got asked, sorry, before I go back to menopause, just a bit about leave, because I got very confused about sick pay and annual leave and what they can force you to take. So their sick pay runs out in November and they're going back 2.5 weeks later. So they're taking 2.5 weeks of unpaid leave, but they need to take time off for radiotherapy. Do they have to use their annual leave for that?
The question is all about money.
Yes.
In the final analysis. So what happens at the moment is people are told to take leave because they're often, when they're still off sick, as a way of boosting their income, because they're either about to go on half pay or they're about to run out of pay. And yes, that is a way of kind of keeping the wolf from the door. You use your holiday pay because then it means that you don't, you know, if you run out of sick pay, then it's still paying the bills.
Yeah.
The problem is that if you use up all your holiday pay rather than take, say, half pay, you know, rather than go on half pay of sick pay, then when it comes to having a holiday, you're stuffed. Technical term. So in the end, if you run out of sick pay, you know, you've gone from full pay to half pay and now you haven't got any pay, and you don't want to use your holiday pay, then potentially you'd have to take that as unpaid time. But it is always worth, I should say, talking to either Macmillan or Citizens Advice or in the Maggie's centres to look at benefits, because if, for example, you do run out of sick pay and, you know, fundamentally you can't work because you're on long-term sick, then potentially you might be eligible to the new style employment support allowance or universal credit. I'm not a benefits advisor.
No, but the guys at Maggie's and Macmillan are very good at helping you go through what you can and can't claim. So that's worth looking at it.
Yeah. And, you know, if you can't, for whatever reason, get to them, then Citizens Advice, who have a good online service as well. So, you know, I think it's entirely inappropriate for people to sort of say, well, you can always use your holiday as a sort of first default thing when there may be other options. But fundamentally, if, you know, you really haven't got the income and you need to use your holiday pay, then maybe you have to do it. But I mean, there are many employers we work with, I'm afraid the NHS isn't one of them, where employers can be relatively generous and will either extend sick pay for another 3 months or sometimes 6 months, or they will have insurance policies which will continue to, you know, help people while they're having treatment, because these days treatment can be, you know, 18 months, 2 years, depending on, you know, Herceptin infusions can sometimes with some people be debilitating and they can't work.
They can.
Very much.
They can.
So it is tough. It is very tough.
So someone's asked, do we know what should be in an ideal menopause policy?
Well, actually, it's funny, just before this call, I went on the web. There are about 25 million menopause policies, strangely.
Seriously
now. On the
oh
web.
My God.
So somebody's making some money out of it. I mean, one of the things I think it's important is for employers to recognise that the menopause isn't just about older women. So they need to understand that a menopause policy covers menopause caused by things like cancer, hormone treatment, as well as getting older. I think it's important that any menopause policy should explain what menopause is. They should talk about the fact that adjustments can be made, regardless of the Equality Act. These are the kind of things you can do. They should advise line managers about how they should handle those conversations, what they should say and when, and how they should continue to support somebody. And they should also point people to where they can kind of get support or advice or other resources. Increasingly, we've found organisations are setting up menopause support groups. I don't know how successful they are. They tend to be in larger companies. But I think the other thing is just talking about it rather than joking about it. So treat it as a serious issue.
I think so. And I guess just thinking of changes, we've talked about kind of changing how you work, writing things down, taking the time to do that, document properly, potentially fans at the desk. You may need to ask about a change of uniform. Often wearing layers that you can strip off and on. You might not need you can't wear what everyone else is wearing because you're stripping off and on all the time. So again, thinking about layers, things you can take off, deodorant and powder and cooling mists to cool you down. It's kind of learning how to live in this new state of your life. And part of it is accepting that it's happening to you, rather than fighting it, because it's horrible, but it is happening, and it may be for 3 or 4 years. You're kind of thinking, right, okay,
Yeah.
I have to deal with this.
Yeah.
I have to put, as hard as it is, I have to do my bit to try and make my life a little bit easier.
Yeah.
And then you can tell your employer, you're doing this, you're doing that. This is a thought that came to me before we go. So if you have cancer-related menopause, your employer should make reasonable adjustments. But all the other women in the menopause, he doesn't have to do anything for them. How do you stop you being the one they all hate? Because you're the one who gets the fan and you're the one who gets the breaks.
Well, I think in that sense, you know, I mean, we're all in this together. So I'd like to think that any adjustments that will be made for you as a person would be made for other people as well. So as I said, the example of having a fan on your desk, you know, then why, I mean, how expensive is this was an ordinary mechanical, well, it was a plug-in fan. It was nothing, it wasn't a Dyson, you know, whatever. You know, why wouldn't they do that generally for people? You know, you know, there are so many organizations, aren't there, Liz, where they say our people are our greatest asset. Well, maybe they should sometimes put their money where their mouth is.
I know. And even so, someone says, I'm hot desking, so I can't have a fan. But do you just think, okay, we'll club together and buy a fan for every desk? Yeah. We will do it ourselves. We'll get it pat tested. We will move it around. It's common sense, isn't it?
Yeah. But I think, you know, there's a lot to be said for, you know, within departments, within teams, about women saying, well, actually, yes, it would, you know, and talking to the managers of that department or whatever and saying it would be really helpful if we could do this. I mean, if you act, you know, I think I'm a great believer, if you act reasonably, then the onus is on the other party to act, or the side to act reasonably. And these aren't, you know, these aren't necessarily big, expensive changes we're talking about. They're often little things that you're asking for. The issue is kind of being able to ask for them without feeling you're going to be penalized. But you know, I think the one good thing about the kind of menopause movement is that people are talking about it, people are taking women seriously, and it's important to step up and, what's that phrase, lean in and ask for the support that you need.
And instead of writing an angry email at 5 o'clock on a Friday, write it but send it to yourself. And then rewrite it calmly. It's taking the emotion out of the request, isn't it? This is the menopause. I have cancer. I need you to do this for me. You have to, because I'm legally disabled. But has this been helpful, everybody listening? I hope we've given you some confidence to go ahead and ask for reasonable adjustments that can help you back at work. You are legally disabled under the Cancer Equality Act, and you can tell your employers that, and they have to make reasonable adjustments. And no one says what a reasonable adjustment is. That's up to the discretion of your employers, but I really hope that you can get the help you need. And if you want more chats about work in cancer, let me know and I'll organise another live. I'm going to tootle off now and go and feed the dog. See you all later.